Tonight, on Legislative Review. A controversial push to limit other states' National Guard troops from deploying in Washington. Plus, hospital pricing transparency. And Senate Republicans released their proposed operating budget. From Olympia, this is Legislative Review. Welcome and thanks for watching Legislative Review. I'm Angela Nolasco.
House Bill 1321.
We start our coverage with a controversial new bill making headlines statewide.
If an invasionary force is intent on invading the state of Washington, a Washington state law is not going to stop them.
Nobody wants uninvited guests in their living room or in their backyard, and I would say that is doubly the case if those guests arrive with guns. We can still invite the National Guard and other states to come help us, which they will do like they always have, and we appreciate their support. This legislation is about making sure that we have consent when that happens.
House Bill 1321, which sparked a heated debate in the House Monday afternoon, seeks to limit external military forces, like other states' National Guard troops, from entering Washington state without permission from the governor or direct federal authority of the president. The bill is a response to a joint statement released by 26 Republican governors back in December about President Donald Trump's deportation policies, saying they were, quote, ready to utilize every tool at their disposal, whether through law enforcement or the National Guard, end quote. For some, the bill is about maintaining state autonomy, ensuring that Washington state remains in control of its own affairs, without other states' forces interfering with Washington's policies, in light of political shifts. While opponents argue that it could restrict the deportation of dangerous criminals and disaster relief efforts.
He just got tased and he's down on the ground.
Democratic Representative Charlotte Mena is the bill's prime sponsor.
Without this bill, there is nothing to prevent other states from sending their National Guards here to carry out their own agendas. I, for one, do not want an outside armed force in our state enforcing policies that may not be consistent with what we have in the state of Washington, which could lead to unrest or potential conflict.
Speaking in opposition, Republican Representative Jim Walsh.
Speaking hypothetically, if President Trump federalizes the National Guard to take some kind of action here in Washington, this bill does not prevent that from happening. The major issues at play of National Guard's units being activated to controversial or non-controversial ends, not affected by this proposal.
6 amendments were debated before the House took a floor vote.
The Speaker has started the roll call machine. Has every member voted? Representative Barkis, how do you vote? Representative Bark? Does any member wish to change their vote? The Speaker is about to lock the roll call machine. The Speaker has locked the roll call machine. The clerk will take the record.
Mr. Speaker, there are 58 yeas, 37 nays, 3 excused.
Having received a constitutional majority, substitute House Bill 1321 is declared passed.
The bill passed and will be up for review in the Senate. It includes an emergency clause, meaning it would take effect immediately once signed into law. We turn our attention to the Senate, where a bipartisan bill concerning hospital pricing transparency was discussed on the floor Tuesday morning. Senate Bill 5493, which follows a federal regulation enacted earlier this year, aims to make hospitals more open about their pricing practices so consumers can fully understand their cost of care. If passed, they'll need to publish clear, machine-readable data on the prices they charge for various services and submit that information to the Washington State Department of Health annually, beginning July 2027. The data will include charges for all hospital services and a consumer-friendly list for at least 300 so-called shoppable services, those that can be scheduled in advance, like routine procedures. With the rising costs of healthcare, advocates say the bill would allow patients to make more informed choices about their care and have clearer expectations of how much they would have to pay before receiving services. They claim that while federal regulations require hospitals to provide this data, enforcement has been lacking, making state-level action all the more essential. Democratic Senator Marcus Riccelli sponsored the bill.
Transparency means more competition. It means more access for patients and consumers to understand where their dollars are going and how they can make informed decisions, and I'd ask for a yes vote.
Also speaking in support, Republican Senator Ron Mazzal.
Transparency, especially when it comes to health care costs, is a good thing. I will be voting yes.
The Senate voted on the bill.
Mr. President, there are 49 ayes, 0 nay.
I received a constitutional majority substitute. Senate Bill 5493 is declared passed. The title of the bill will be the title of the act.
The bill passed in a unanimous vote and heads to the House of Representatives for further consideration. Senate Republicans released their proposed state operating budget at a press conference Tuesday. The budget proposes a so-called third-way approach, which considers a move away from 1, taxes, and 2, budget cuts, and proposes to forego increases yet to take effect, such as state employee pay raises and social service pay increases. Senate budget writers say it would maximize the use of all available resources, like the Climate Commitment Act and surpluses outside of the general fund. Part of the proposal, a $2 billion increase for K-12 education and no tuition increase for higher education. Senate Minority Deputy Leader Chris Gildon calls it an honest budget with no taxes or slashes.
We provide $200 million each to our schools for supplies, operating costs, special education. We increase the number of higher education slots.
The budget also proposes a freeze on rates for state-subsidized child care and no reductions to hours of care involving seniors, people with disabilities, and behavioral health treatment. For state employees, a $5,000 bonus instead of a $4 billion total in salary increases statewide. $100 million in grants for law enforcement staffing. And shifting the Working Families Tax Credit funding source to the Climate Commitment Act. As far as government cuts across the board, as Governor Bob Ferguson promised earlier this session, Senator Gildon had this to say.
We are going to take the lead in the legislature, the House and the Senate. We are going to assume 6% cuts for ourselves. But then we're going to kind of be a little more nuanced when it comes to the other agencies. So if you are a general services agency, meaning you do not provide services directly to people in our state, we're only going to ask you for a 3% across the board reduction, 0% across the board for those agencies that provide services directly to people, because that's important. We've got to take care of people.
In response, lead budget writer for Senate Democrats June Robinson released a statement saying the Republican budget, quote, includes $6 billion in reductions and unsustainable choices, treats the Climate Commitment Act as a piggy bank for unrelated programs, fails to fund the collective bargaining agreement for state employees, and tries to do more without paying for it, end quote. Her full statement is available to view on senatedemocrats.wa.gov. Access to the full Senate Republican budget presser is available on demand on tvw.org. And that's a wrap for this episode of Legislative Review. Join us nightly at 8 and 11 to keep up with what's happening in the state legislature.